So the House, along with Representative Pramila Jayapal, have a new Medicare for All bill. So what's going on here, and how does this article unpack it? All right, so Representative Jayapal is introducing the most ambitious Medicare for All plan yet, one that envisions a quick transition to a public health plan with a robust set of benefits. The co-chair of the Progressive Caucus is releasing a proposal Wednesday to transition the United States to a single-payer healthcare system, one in which a single government-run health plan provides insurance coverage to all Americans. We mean a complete transformation of our healthcare system, and we mean a system where there are no private insurance companies that provide these core benefits. We mean universal care, everybody in, nobody out. Jayapal's bill envisions a future where all Americans have health coverage and pay nothing out of pocket when they visit a doctor or hospital. Her plan, the Medicare for All Act of 2019, describes a benefit package that is more generous than what other single-payer countries like England or Canada currently offer. The benefits in Jayapal's bill are even more generous than those included in Bernie Sanders' Medicare for All plan. But where the Jayapal plan has great detail into what is covered, it does not get into a crucial question: how the government will pay for the new healthcare program. They always mention that real quick, don't they? They love to mention that. And we'll go through this article, and you'll see there's a lot of kind of like status quo favored language going on in it. But what no one loves to point out in any media piece, I'm not even singling this one out, the corporate media, whenever they point out how are we going to pay for this, how can we afford this, they never point out the glaring truth that we already spend more on our GDP on healthcare than any other country. We spend the most on healthcare already, by far. By far. Like no one even comes close to us, and it's because our system's so fucked up. So we're already spending the money. That's just it. We're already spending it. And what we could do is have a reallocation of resources so that not only do we spend less of it, but we spend it more wisely, and human beings are not excluded. We have the type of system most of the rest of the all of the industrialized world and most of the world takes for granted. We have that in the United States, the richest country in the world. That's what a Medicare for All plan does. But people always talk about, well, how are you going to pay for it? Instead of, hey, how are we going to reallocate these resources? You know, if you're overpaying for a car and you want to keep that car, the question you ask is not, how am I going to afford this car? The question is, how can I better reallocate my resources to spend more wisely for this car? It turns out I took some predatory loan where I'm overpaying by about 300% on my car payment. How can I refinance so that my car payment is reasonable and what I should be paying? Not, oh, how am I going to afford this car? But that's what when it comes to healthcare, for some reason, we throw logic out the window immediately and go to how are we going to pay for it when we're already paying more than all the other countries. Isn't that interesting? All right, so let's continue. The new proposal comes at a moment that Democrats are coalescing around the Medicare for All platform. Frontrunner candidates in the Democratic primary, like Kamala Harris, Cory Booker, and Elizabeth Warren, have all signed on as co-sponsors to Sanders' single-payer plan in the Senate. The healthcare industry has already begun a gird for a major healthcare fight should a Democrat win in 2020, recently launching a new coalition of hospitals, insurers, and drug makers to oppose the Medicare for All agenda. That's an interesting thing to note. It's also worth noting that there are many doctors, many nurses, many medical practitioners that are for a single-payer system. I'm sure some aren't too. I mean, of course, but a lot are. In fact, in California, where I live, our single-payer bill, you know who was pushing for it? A nurses association. The Nurses Association was pushing for a single-payer bill. And when they were protesting for it to get its fair shake, because it was shelved by an insider, by a corrupt politician named Anthony Rendon. When it was shelved and stabbed in the back, and they protested it, they were told to shut the fuck up and get out of the room at the convention. Literally, like I'm saying this verbatim, like I'm quoting, they were told to shut the fuck up. Shut the fuck up and get out. That's why our system's broken, by the way. But anyway, getting back to this. So Jayapal's Medicare for All plan has a very generous benefit package and a quick transition to government-run healthcare. Jayapal, first of all, it's not government-run healthcare. So right there, that's something that's a little bit dishonest in this article. It's just government orchestrated healthcare. The healthcare is still run by the hospitals and the doctors. It's not like the government is deciding what care you do and don't need. They're just the bookkeepers. All right, JPL's single-payer proposal would create a universal Medicare program that covers all American residents in one government-overseen health plan. It would bar employers from offering separate plans that compete with this new government-run. All right, they're just going to keep saying it. We get it. It would, however, allow two existing health plans to continue to operate as they do now, the Veterans Affairs Health System and the Indian Health Services. Those who do qualify for the new Medicare plan would transition into the program over the course of 2 years. This would start with people under 19 and over 15, moving into the program 1 year, and everyone else a year after that. It's worth noting, and I guess by they mean those who do qualify, they mean everybody else unless you're in one of these two things. If you're in one of these two programs, you can stay, Veteran Affairs or Indian Health Services. If you're in anything else, you go into this plan. It's worth noting that this is actually a faster transition than what Senator Sanders envisions in his proposal. Eventually, everyone would end up in the same plan. JPL's plan also includes coverage for long-term services and nursing services. Long-term care services for nursing services. The current Medicare program does not include this benefit, nor does Sanders' plan. This will make the healthcare system she envisions more generous, but also more expensive. The plan is significantly more generous than the single-payer plans run by America's peer country. The Canadian healthcare system does not cover vision or dental. Okay, the Netherlands has a similar set of benefits, as does Australia. What's more, the JPL plan does not require consumers to pay any out-of-pocket spending on health aside from prescription drugs. This means no charge when you go to the doctor, no co-payments when you visit the emergency room. All those services would be covered. This too is not. There was a part of this article I want to get to. This too is not in line with international single-payer systems, which often require some payment for those seeking services. Taiwan's single-payer system charges patients. In Australia, people pay 15% of their costs when they visit a specialty doctor. So there's a part of this article that I'm not finding now where they talk about how this is because they just pointed out two countries. What they didn't tell you, in France, in most cases, you do not pay a dime out of pocket. And in the cases that you do, it's something very negligible. So there's one system that they're saying, oh, this is different than the other single-payer systems. Here's two for instances. Well, okay, France. You barely pay anything out of pocket in France, if ever. And they have the best healthcare system in the world. What I find a little bit worth critique of this article is that they're saying it, they're kind of implying that this is so much more ambitious than most single-payer plans out there. I do not believe it is. I think it's reasonable, first of all. And second of all, shouldn't we want to have the best plan? I mean, there's so many, for instances, where the United States is always trying to be the best. Why don't they write an article about this regarding our military spending? Why don't they write an article saying, hey, we spend more than the next 13 countries combined? Hey, we spend more on our military than pretty much everybody. We dwarf every other country when it comes to military spending. Why don't they write an article like that? Why don't they say something like, hey, because we already spend more than twice as much as every other country, it would make sense we would want to have the best plan. Even if our system would be more generous than every other system out there, and again, based on this article, I don't think that means for sure that it is by any stretch. I mean, they listed a small handful of countries. They didn't bother mentioning. Just a basic Google search, which I did right before the show, shows you, in most cases, France, they pay zero out of pocket. And when they do, it's like maybe 30%. And it's not for anything serious. It's for something negligible. If it's a big thing, they don't pay a dime. They get reimbursed by the government. They have the best healthcare system in the world. If you're doing research on this topic, wouldn't you start with the number one rated system and see what they do? And a basic Google search would tell you they usually don't pay anything out of pocket. Meanwhile, this article is pretending like, oh, basically every system we know. And here, let me try to find that part in the article. Financing the health system that both JPL envisions is an immense challenge. About half of the countries that attempt to build single-payer systems fail. I would be curious to see this statistic. I'd be very curious to see this statistic. That's Harvard Health's economist William Haslow's estimate after working with about 10 governments in the past 2 decades. Whether he is in Taiwan, Cyprus, or Vermont. Okay, Vermont's not a country. Vermont's a state. The process is roughly the same. Meet with legislators, drop a plan, write legislation. Only half those bills actually become law. The part where it collapses is inevitably when the country has to pay for it. Okay, so that doesn't mean single payer is a failed system. That means this particular person has written up bills that haven't been passed for whatever reason. So this entire paragraph is completely misleading and does not. Their thesis, about half the countries that attempt to build single-payer systems fail. What are they basing it off of? This one person who worked with a handful of governments and only got half the bills to become law. In this case, which, by the way, they mentioned 2 countries and 1 state. So they say half the countries, and then they mention a state. So this entire paragraph is bullshit. This entire paragraph shouldn't even be in this article. It is just a subtle way to shit on the idea of single-payer healthcare. This is what happens when Sanders, Vermont, attempted to create a single-payer plan in 2014. Much like JPL, local legislators outlined a clear vision of the type of health plan they'd want to extend to all Vermonters. Their plan was arguably less ambitious. It did require copays, but Vermont's single-payer dream fell apart when the state figured out how much it would need to raise taxes to finance its new system. Vermont abandoned the government-run plan after finding it would need to increase payroll taxes by 11.5% and income tax by 9%. So what they don't mention here is another state, the state I live in, California, when we found out that implementing our single-payer system would save us money. We find out that we'd be paying less of our GDP if we had a single-payer system. And the bill was stabbed in the back and shelved anyway by Anthony Rendon, who had the authority to do that. And why did he do that? Because he gets paid off by the insurance industries. It's interesting they point to Vermont, you know, who in this, and I'm not crazy fluent in Vermont's situation, but yeah, it looks like they didn't dot all their I's and cross all their T's in this one for instance. Whereas, by the way, if you're going to be like, well, look at Vermont, that's Bernie's state, and this could, okay, Medicare for All, Bernie already lays out how we're going to pay for it, and study after study after study, even a study funded by the Koch brothers, indicated that it saves us money. Medicare for All saves the American people money. All right, so single-payer systems change who pays for healthcare, often shifting more of the burden onto wealthier individuals to create a more progressive system. The proposed 9% income tax in Vermont, for example, would be far more expensive for the $100,000 worker than the $30,000 earner. A single-payer system is based on income, but who pays how much more is the key question this JPL bill doesn't answer until there is, and it's typical for bills at this stage to not have all those questions answered, by the way. That's very typical. And what this article does not point out, first of all, it does not point out that many single-payer systems, there are not out-of-pocket costs, first of all. It does not point out that we're already spending more than every other industrialized country on healthcare. We spend more than every other country. So when we get a single-payer plan, it should be the best and the most generous. It should be. So even if all the claims they're making to imply that this plan is unrealistic, which it isn't unrealistic, it's just the type of healthcare plan the industrialized world takes for granted that we don't have because of a corrupt insurance industry that shouldn't exist. Even if it was that much better than every other country's plan, why wouldn't we celebrate that? You always hear USA number one, we're number one, except when it comes to helping people. If this plan is so much better, then shouldn't that be the plan we go for? Shouldn't we want to have the best healthcare in the world, especially since we've been paying the price to have that for years and years and years? We spend more than everybody. We spend more on healthcare than everybody. And we get less. So if we pass the best single-payer plan there's ever been, we deserve it. Quite frankly. So what a weird... You know, obviously this article is subtly trying to dismiss the idea of single-payer, and they do so in a very intellectually lazy way. They highlight just a small handful of countries They highlight one person's experience to back up the thesis that single payer fails. They mention Vermont. They don't mention California, which was a more recent, for instance.
Get your news on with Ron. Don't you wanna know what's going on? We're getting our news on today. Get your news on with Ron. Don't you wanna know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your